Good morning, colleagues. My name is Elisa Prieto, and I am the Non-Communicable Diseases and Mental Health Advisor at PAHO's Regional Coordination Office for the Caribbean. It is my honor and pleasure to be your moderator today for the launch of this Caribbean Public Health Law Forum, which is being convened by the Pan American Health Organization and the Caribbean Court of Justice Academy for Law, with the goal of advancing the use of law to tackle NCDs. I would like to start by recognizing the distinguished participants that are joining us today. The Honorable Mr. Justice Winston Anderson, Judge of the Caribbean Court of Justice and Chairman of the Caribbean Court of Justice Academy for Law. Mr. Dean Chambliss, Sub-Regional Program Director at PAHO's Office of Sub-Regional Program Coordination for the Caribbean. Dr. Gordon Boyle, Program Manager, Health Sector Development at the CARICOM Community Secretariat. Sir Trevor Hassel, President of the Healthy Caribbean Coalition, Mrs. Nicole Foster, Deputy Dean, Academic and Student Affairs at the Faculty of Law at UWI Cave Hill Campus, our longstanding partners at the Union and the International Legal Consumption Campaign for Tobacco-Free Kids, members of the forum, including CARICOM institutions, civil society, academia, and delegates from Ministries of Health and Legal Affairs, members of the media. Ladies and gentlemen, a very warm welcome. The session today will include two panel discussions that will explore the background, objectives, and expected outcomes from the perspective of institutions represented in the forum, but we will also have an opportunity to learn from the experiences of our member states and their vision for how the forum can help advance their NCD and prevention and control agenda. So before we move onto the opening remarks, I would like to encourage that you use the Q&A function, which you will find at the bottom of your screen, to ask any questions that you may have throughout the duration of the session. And with that, I would like to introduce our first speaker, Mr. Dean Chambliss, who will be bringing opening remarks on behalf of the Pan American Health Organization. Mr. Chambliss, the floor is yours. Over.
Good morning. Thank you very much, Dr. Prieto. And I would say good morning to everyone from what is currently a very stormy Barbados. Protocol having been established, I would like to welcome all of you to this virtual launch of the Caribbean Public Health Law Forum, which PAHO is pleased to now convene together with the Caribbean Court of Justice Academy for Law. The Caribbean Public Health Law Forum, the first of its kind in the region, is the brainchild of the Caribbean people, including many of you, who have engaged in the ongoing efforts to foster better health law collaboration. Indeed, the establishment of a Caribbean network to facilitate continued communication, collaboration, and engagement between health and legal affairs was identified as a priority action at the sub-regional workshop on the use of law to address non-communicable diseases in the Caribbean, hosted by PAHO and the International Legal Consortium from the Campaign for Tobacco-Free Kids in March of 2020. The Caribbean's legacy of leadership in addressing NCDs dates back to 2007, when the CARICOM heads of state and government met in Port of Spain, convening for the first time on this health matter. The resulting Port of Spain declaration elevated NCDs to the global stage and paved the way for the first UN high-level meeting for the prevention and control of NCDs in 2011 and subsequent mandates. However, sustaining that earlier momentum to address NCDs has proven to be a challenge, despite the existence of clear mandates and feasible, cost-effective interventions, including the so-called WHO best buys for NCD management and risk factor prevention. Importantly, this lack of progress continues to be most prominent for those interventions that require the effective use of law and regulations. As a result, NCDs and their main risk factors, namely tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity, remain the leading causes of morbidity, mortality, and disability in the Caribbean. Indeed, NCDs cause 8 in every 10 deaths in this region. 1/3 of all NCD deaths occur prematurely in persons 30 to 70 years of age, impacting the region's human and socioeconomic development. The situation has worsened during the current COVID-19 pandemic, as persons living with NCDs are at greater risk of becoming severely ill and dying from COVID-19. Additionally, we are witnessing disruptions in essential healthcare services, as well as the impact of lockdowns on diet and physical activity, all serving to worsen outcomes for persons living with NCDs. There is therefore an urgency to adopt effective interventions to address NCDs and their risk factors. The Caribbean Public Health Law Forum that we are launching today aims to accelerate action through ongoing knowledge exchange, capacity building, and cooperation across various sectors of society, government, civil society, academia, and across different fields, health and law, and across countries and territories. This level of engagement is now more pertinent than ever before, as the Caribbean reaffirms its commitment to solidarity, partnerships, and health as a regional public good. Caribbean regional mechanisms and institutions will collectively lead the pandemic recovery to emerge as a stronger, more resilient region. I would like to end these remarks by thanking the Caribbean Court of Justice Academy for Law for their leadership and commitment to making this forum possible. I would also like to thank the other CARICOM institutions, civil society, academia, and ministries of health and legal affairs that have enthusiastically joined the forum and contributed to its realization. I thank our international partners at Public Health England, the Union, and the Campaign for Tobacco-Free Kids for their continued support. And not least, I thank all of you distinguished guests and participants for taking the time to join us today. I wish you an enjoyable and productive session and every success as you take forward the Caribbean Public Health Law Forum. Thank you, and back to you, Dr. Prieto.
Thank you so much, Dean, for those opening remarks. And I would like to invite now the Honorable Mr. Justice Winston Anderson, Judge of the Caribbean Court of Justice and Chairman of the Caribbean Court of Justice Academy for Law, to provide his opening remarks. Over to you, Justice.
Thank you, Dr. Prieto. Distinguished participants, colleagues, ladies and gentlemen. It is my pleasant duty to bring greetings on behalf of the Caribbean Court of Justice, CCJ Academy for Law. The Academy joins with PAHO in welcoming you to the launch of the Caribbean Public Health Law Forum, which we consider to be important, timely, and urgent. A Caribbean Public Health Forum, which brings into a common space regional experts from the disciplines of health, law, civil society, and academia, presents an important opportunity to discuss and make proposals for implementing public health measures which require urgent legal and regulatory action. The forum will be a virtual platform, and when the current pandemic relents, also a physical platform to engage in conversations and to make proposals on the use of law to tackle public health challenges, notably non-communicable diseases, NCDs, and their risk factors. NCDs such as hypertension, diabetes, cancers, and chronic respiratory diseases take a heavy toll on Caribbean societies, accounting for approximately 3 out of every 4 deaths and over US $1 billion per year in direct and indirect costs. We fully expect that the ongoing outputs of the forum will place member states and associate member states of CARICOM in a better position to address their respective NCDs agendas. These outputs will also serve to raise a level of consciousness within the general population about the importance of legal measures to safeguard their human rights, notably their right to health, through the leveling of the current inequitable playing fields by creating overall healthier environments where the individual's ability to make healthy choices becomes easier. Again, the Academy welcomes you to the birth of this very important initiative. We congratulate all of those responsible for bringing us to this place. In particular, the steering committee comprising representatives of our partners in PAHO, CARICOM, UWI, and HCC. Thank you for your hard work, which has made this day possible. The Academy wishes the forum every success. Thank you.
Thank you, Justice Anderson. And now, before we move into our first panel discussion, we would like to go over the next few minutes to pay a tribute to Rose Nathan, Associate Legal Director at the International Legal Consortium of the Campaign for Tobacco-Free Kids, who was a very well-known and appreciated colleague for her support and dedication to the Caribbean region over the course of her nearly 20 years of efforts on tobacco control. So I would like to invite Patricia Lambert, Vice President of the International Legal Consortium Campaign for Tobacco-Free Kids, to take the floor and share with us this tribute to Rose. Over to you, Patricia.
Thank you very much, Dr. Prieto. I greet you on behalf of the Campaign for Tobacco-Free Kids. I cannot apologize for my emotionalism. Just seeing Rose's face on this slide reminds us all of how much we miss her and how very sudden and untimely Rose's death was. Rose, as Dr. Prieto has said, was a champion for tobacco control and a champion for public health generally for more than 20 years of her life. She was very well respected throughout the globe. Her passion for tobacco control, for the Framework Convention on Tobacco Control, and for public health generally made her a force to be reckoned with. Rose had also a particular love of the Caribbean, and she loved her portfolio for the ILC as our representative in the Caribbean countries. She loved visiting the countries and she treasured the relationships that she made. The last time that we all saw Rose was in March of last year at the meeting in Miami. And it was also the last time that I saw Rose alive. So our indebtedness to Rose for the work that she has done and our admiration for her will keep us working enthusiastically and passionately alongside PAHO and alongside the Academy of Law for this initiative. We are proud to be associated with you, and we will move forward in Rose's name so that we continue to fulfill her dream of a tobacco-free Caribbean. Thank you very much.
Thank you so much, Patricia, for those moving words. I think many of us share your emotion when we see Rose's picture, and we remember the great work and the great colleague that she was to all of us. So thanks for that. I would like now to welcome Dr. Ansam Hennes, Director of the Non-Communicable Diseases and Mental Health Department at PAHO, who will be chairing our first panel today, focusing on the background, objectives, and expected outcome of the forum. Dr. Hennes will be joined by Dr. Ignacio Ibarra, Advisor, Health-Related Legislation at the Office of the Legal Counsel of PAHO, the Honorable Mr. Justice Winston Anderson, Judge of the CCJ and Chairman of the CCJ Academy for Law, Dr. Karen Gordon-Boyle, Program Manager, Health Sector Development at the Caribbean Community Secretariat, and Sir Trevor Hassel, President of the Healthy Caribbean Coalition. So Dr. Hennes, thanks for joining us, and the floor is yours.
Yes, morning. Thanks so much, Elisa. It is a pleasure to chair this first panel. The Caribbean Public Health Law Forum being launched today represents one of the key priorities emerging from the sub-regional workshop on the use of law to address non-communicable diseases in the Caribbean as you heard, which was hosted in March of 2020 by PAHO in collaboration with the International Legal Consortium of the Campaign for Tobacco-Free Kids, with support from the European Union. The sub-regional workshop, which brought together 44 participants from the Caribbean with diverse backgrounds, sought to build capacity in use of laws and regulations to address NCDs and their risk factors. The forum also builds on early efforts to foster intersectoral collaboration between health and legal affairs, and to increase awareness and capacity building among legal officers on NCD-related topics, including a sub-regional workshop on law and NCDs for Caribbean countries, which was convened by PAHO in 2017, and a high-level meeting on the use of law to tackle NCDs, which is co-hosted by PAHO, FAO, and the Caribbean Court of Justice Academy for Law in 2018. This high-level meeting convened judges of the Caribbean Court of Justice, relevant CARICOM bodies and institutions, key policymakers, including the chairs of the COSOD and the COTED, regional partners, and international organizations, and resulted in a meeting statement and a set of agreed priority actions, which included a proposal to establish a Caribbean network of legal officers. The forum is therefore being launched today in response to a clear request from our member states, CARICOM institutions, and regional partners. We're very pleased to already have a strong forum with 64 members from 9 CARICOM member states and all 5 associate states, including 44 government officials working in health and/or law, along with representatives from various regional organizations and institutions, namely the CARICOM Secretariat, the CARICOM Single Market and Economy Unit, the Office of Trade Negotiations, the Caribbean Public Health Agency, the CCJ Academy for Law, and the Law Faculty of the University of the West Indies, Cave Hill. As we heard in the opening remarks, the Caribbean is experiencing a relentless epidemic of non-communicable diseases with enormous health, socioeconomic, and developmental consequences. This silent epidemic is being further aggravated by the COVID-19 pandemic, as persons living with NCDs are at increased risk of severe disease and death from COVID-19. There is therefore an urgency to act, to retake the Caribbean's early leadership in addressing NCDs, and to accelerate the implementation of the many global, regional, and Caribbean mandates, and the so-called WHO Best Buys, a set of evidence-based and very cost-effective interventions to improve the health and well-being of our people. I'm confident that the forum will be a crucial tool to catalyze these changes. Welcome to the members of the panel. I'd like to start this conversation by reflecting on the crucial role of law in curbing the NCD epidemic. As many of you know, 10 of the 16 WHO Best Buys require the effective use of law or regulations. Moreover, the Tobacco Control Best Buys are also part of the WHO Framework Convention on Tobacco Control, which is a legally binding international public health treaty that sets out obligations on parties to implement tobacco control measures. However, the Caribbean continues to lag in implementing the set of evidence-based, feasible, and very cost-effective interventions for the prevention of NCDs, despite the enormous burden of disease and strong mandates. So my first question now is to Ignacio. Dr. Ibarra, could you tell us more about the role that law plays in addressing NCDs and their risk factors, and how you envisage the forum being a catalyst for progress in this area in the Caribbean? Over to you, Ignacio.
Thank you, Dr. Hennis. Good morning to all. It's a real pleasure for me to be part of this launching. It has been the product of the tireless work of an increasingly broad, multidisciplinary team that has joined efforts from different institutional perspectives. We can see it with all the participants today. At the Office of the Legal Counsel of PAHO, we have a clear mandate adopted by our Directing Council, led by the Ministers of Health of all the region, to provide support to our member states in the strengthening of health-related law as may be requested, especially in the path for the realization of the right to health, including universal health coverage. For that purpose, several workshops, meetings, and capacity building activities have been convened by PAHO in a collaborative manner in the Caribbean, as Dr. Hennis highlighted, to exchange experiences, share the best identified legal practices, and mainly to discuss about the problems being faced daily in the real world by the lawyers and public health officials from the Ministries of Health and the offices of Attorney General. In other parts of the region, even being challenged in courts. As highlighted in the opening remarks, addressing non-communicable diseases and the risk factors is one of the most powerful ways of improving longevity and healthy life. And now it is clear that the most cost-effective public health measures recommended by the WHO require the effective use of law or regulations. Why? Because the behavior of the persons is a determinant of health, and educating communities and doing health promotion are very important public health measures, but they are not enough. For example, when smoking, the decision of the smoker to use tobacco should be limited by the right of the other surrounding persons to stay healthy. So the law protecting the majority serves as a powerful catalyst of public health decisions, mainly because the consequences of their breaches. The health authorities should also have clear and strong mandates to act promoting the right to health, as it is a human right protected in the Caribbean, and some countries even have it as a constitutional mandate. So the law can also institutionalize the outcomes in public health for the protection of all. On the other side, the industry that manufactures unhealthy products that lead to non-communicable diseases have aggressive marketing practices targeted to the young and persons that do not have enough and clear access to information, thus the real power to decide. The industry almost all the time overwhelmed the modest activity of the government in this field. We think that a useful tool to equalize these disparities can be through the enacting and enforcement of laws. I really think that a forum like the one we are launching today will serve as a bridge to communicate and exchange experiences, thoughts, and even questions among specialists in all the public health arenas, including the lawyers working on health matters, and PAHO, through the Secretariat, will be behind to support this work. There is a lot to be shared, more to be analyzed. Even legal and public health doctrine should be developed as well, as Mr. Justice Anderson pointed out. So promoting the linkage between public health officials and the lawyers with the active participation of civil society and the academia all together can make a huge difference in the public health outcomes. Remember that laws are also a determinant of health, as weak or missing legislation can pose loopholes and barriers to access to health. There are some of the challenges we want this forum to assume. The law can be used as a catapult for public health results, as it can put health authorities a step ahead of the challenges and serve as a support to sidestep the onset of avoidable illnesses. This is the purpose of the right to health that needs to be enshrined in legislation to be protected. Thank you, Dr. Hennis, and for the audience.
Thank you so much, Dr. Ibarra. You gave us a very comprehensive rule of law to really protect public health. You talked about how law can act as a catalyst. You talked about health as a human right. And you talked about the use of law to help to safeguard public health against the machinations of the private sector, which have different purposes, and also to build linkages between lawyers, public health, and civil society. So thanks for that very comprehensive perspective on the use of law and enforcing laws and enshrining public health within legal frameworks. So that was very, very helpful. Thank you so much for that. My next question then goes to the Honorable Justice Anderson. And really, As I mentioned in my introductory remarks, there have been several efforts to facilitate greater interaction between health and legal affairs, including meetings and capacity building activities hosted by PAHO and its partners. This type of multi-sectoral collaboration lies at the heart of effective NCD prevention and control, and the Caribbean Court of Justice Academy for Law has shown great leadership in convening, together with PAHO, the forum that we're launching today as a space for multi-sectoral collaboration, communication, and exchange. Now, Justice Anderson, could you tell us about the background and objectives of the Caribbean Public Health Law Forum and your expectations for the ongoing involvement of the CCJ Academy for Law in this forum? So over to you, Honorable Justice Anderson.
Yeah, thank you, Dr. Hennis. Thank you for your very kind words about the contribution of the Academy to the efforts that we are realizing today. There is really like an add actually to what has been said before about the background to the forum. It is the case, as I think you and other speakers have indicated, that the idea for the forum was formally born last March in Miami when we met there in a sub-regional workshop. I thought, subject to any corrections that others might give, that it was more or less a spontaneous recognition of the officials at that workshop that it'd be useful to have a platform on which those involved in the disciplines of health and law could share information and experiences and develop strategies for using the law to advance the public health agenda. Now, this kind of initiative, this kind of thinking is very much in line with the objectives of the CCJ Academy for Law. In fact, the first listed objective that we have in our articles, and I'm quoting here, is to participate as an institution in the active pursuit of solutions to legal and social problems that are prevalent in the Caribbean region, end quote. That is the first primary objective of the Academy. So this is perfectly in line with this activity, and it was pursuant to that objective that we accepted the invitation of PAHO to participate in a sub-regional meeting on law and NCDs for Caribbean countries, which was held at the Mona campus in Jamaica in 2017. And at that meeting, at that workshop, the Academy shared on the use of community law to support better public health outcomes. We looked at various provisions in the revised Treaty of Chaguaramas, which of course establishes the Caribbean community, including the CARICOM single market and economy. We looked at various declarations by our heads of state, including the Port of Spain Declaration, which was referenced earlier. And we also examined a number of cases which were relevant to the topic. Indeed, to facilitate the learning environment, we used a hypothetical example, which was very, very well received at that workshop. And that hypothetical example was adopted and adapted to form the 10th CCJ annual international law moot. And that moot was held on the 9th of March, 2018 at the CCJ's headquarters here in Port of Spain. And the moot focused, of course, on the overlap between law on the one hand and wellness and health on the other. The moot was sponsored by PAHO. And as you said, Chairman, it was presided over by judges of this court, the Caribbean Court of Justice, and also, as I recall, by at least one PAHO official. The following day, on the 10th of March, there was a high-level meeting to which you also made reference, which was convened by the Academy in partnership again with PAHO. And the meeting was attended by high-level officials, including ministers and other senior health officials. The focus of the meeting was to promote policy coherence and to strengthen the role of law in addressing NCDs and their risk factors in the region. Emphasis was placed on food and nutrition and tobacco control laws and regulations. And then came, of course, the critical workshop we have all referenced this morning, the March Workshop 2020 in Miami. Now, on this journey since 2017 to the present, the critical turning point, operationally, in my view, was the conclusion of a consultancy sponsored by PAHO and administered through the CCJ Academy for Law on combating NCDs using law. The objectives of that consultancy, that project, was the objectives were threefold. One was to identify mechanisms and strategies to advance a 100% smoke-free environment throughout the Caribbean community by 2022. Secondly, to increase awareness and to facilitate exchanges among legal officers and public health officials on the use of law to address NCDs through the establishment of a Caribbean Public Health Law Forum. And thirdly, to facilitate development and implementation of a training curriculum for tobacco control legislation in the Caribbean. And this would be on the PAHO virtual campus website. I think we have made progress on all of those objectives. Obviously, we have made significant progress on the second one, that is the formation and launch of this forum. And I have to say, and I know that Dr. Prieto would agree with me, that in all of this, we have been very, very fortunate to have attracted, identified, and retained a very excellent young lawyer, Ms. Kimberly Benjamin, who has performed exceptionally well in supporting all of our activities to date. And I wish to pay, as I'm sure all my colleagues do, public commendation to her. For the future, all I can say is that I expect fully that the forum will play a very, very crucial role, a critical role in advancing the cause of using law to combat NCDs in the region. Thank you, Chairman.
Thank you, Honorable Justice, and thank you for sharing so much with us about the achievements, the background, the fact that that law can be a tremendous tool in terms of advancing the aims of public health. And I was struck by your noting that the Caribbean is attempting to be a smoke-free region by 2022. There's not a lot of time left, but South America achieved this last year. And in so doing, they now have 434 million people who are protected from tobacco smoke in public spaces. I think also this will be part of a legacy to honor Rose Nathan. I actually didn't have the privilege of meeting Rose myself, but what I knew was when we had situations in countries where they needed help in tobacco legislation, we would contact Rose, and she'd go to different Caribbean countries and she would spring into action and she would make the changes that were so necessary. So thank you very much, Justice Anderson. Thanks for that very comprehensive perspective. So the next question then goes to Dr. Karen Gordon-Boyle. Now, an important objective of the Caribbean community is enhanced functional cooperation in areas such as health. That's Article 6 of the revised Treaty of Chaguaramas. NCDs present a common challenge across all CARICOM member and associated member states represented in the forum. Furthermore, these member and associate member states, with very few exceptions, share similar legal systems. So Dr. Gordon-Boyle, from the perspective of the CARICOM Secretariat, how do you see the forum contributing to the objective of enhanced functional cooperation and to a regional approach to NCDs?
Thank you very much, and good morning, everyone, and it's an honor to be here. So to address your question, this forum provides us with a unique opportunity to bring together and advocate for, we'd have to call it a paradigm shift in the way we practice medicine across member states, from having a heavy focus on curative medicine to now looking at how we can promote preventative medicine and how we can operationalize that through the establishment of possibly wellness centers, where the focus is on early identification of risk versus managing and treating diseases. if we can come together, bring preventative medicine together with what we can call preventative legislation, the ideals of preventative medicine can now be reinforced and supported with the creation of an environment that makes the healthy choice the easy choice. And henceforth, we need to have preventative legislation in place to support those behavior change ideals. Now, we talk about risk factors. We usually refer to having non-modifiable and modifiable risk factors. And usually we don't tend to focus much on the non-modifiable risk factors because we figure we can't do much about it. I want us to remember that there is that caveat of epigenetics, and we recognize that if a woman is exposed for prolonged periods of extreme stress and hunger and malnutrition, she can give birth to a child that has a predisposition for the development of chronic diseases, cardiovascular diseases, and diabetes later on. And so it's important for us to recognize that we have to be able to engage with our citizens from preconception through to the grave. And as medicine is practiced right now in the Caribbean, well, first and foremost, if we're going to have all our pregnant women engaged in the health system, we need to have free access. We need to have universal health coverage, universal health care. And we know that in some of our member states, we still have fee for service. And so we have to be able to think of legislation, draft legislation that can address that, and advocacy that can address that, or at least the creation of national health insurance schemes that can help subsidize or pay for those who are poor and indigent and can't afford healthcare. So we have an opportunity now to think of legislations to support things like that. But when we also look at the Caribbean, we have an excellent reputation when it comes to, an excellent track record when it comes to immunization. But we tend to lose, these persons tend to drop off the radar once they start to join school. With the advent of the HPV vaccination, this is a wonderful classic example where we have been able to use the law to reinforce public health and to address a chronic disease risk factor, the HPV. And so we have now been able to re-engage with our youths between the ages of 9 and in some countries 16. Those are the countries that have embraced the introduction of the HPV vaccine. And this has allowed us to re-engage. But once they finish that, once again, they drop off the radar until they're either sick or pregnant. We need to be able to engage our citizens from cradle to grave. And we need to be able to look for and identify risk factors very early. We also recognize that the way medicine is practiced, a patient will probably spend, on a good day, half an hour to an hour in front of a doctor, and that's kind of stretching it. What happens when they're not in front of their physician? What's going to enable or help them to make that healthy choice, the easy choice? What's going to happen when you have and create a scenario? This is typical for the Caribbean, a Friday night binge drinking in a bar, the table strewn with multiple bottles of alcohol. What's going to make the healthy choice, the easy choice? So on a good day, a person may have 10 beers, jump in their car and reach home or not. Rewind, the same bar scenario. They sit down to have their beers and they discover the price of the alcohol has doubled because excise taxes have now been levied. Instead of having 10 beers, they're going to be able to reduce it. It becomes an easier choice to cut down on the alcohol intake. Or if the legislation that supports the healthy choice is one that decides we're going to have breathalyzers, police on the roads, and a fee, or it may be mandatory prison time or jail time if someone is found drinking and driving. These are the sort of things that people can now think of and have a second thought, and maybe either have a designated driver, et cetera, et cetera. So these are the sort of things that if we can have draft legislation that sovereign states can now look at, adopt, adapt, and use, it helps to reinforce the message that you will first get in the clinic setting. But after you have left the clinic setting, you can be reinforced now in your day-to-day decision-making. So I really see this forum bringing the legal minds, the public health minds, to create a vision where we now have to see, okay, so many years have passed and we have not made much progress. So how do we now operationalize this? And the creation of wellness centers with a focus on preventative medicine, reinforced by preventative legislation, I think would be critical. And even as we think of urban planning, ensuring that legislation supports the creation of safe spaces for exercising, where you have grounds that have proper lighting, that have enough financial resources to maintain them, where you have community centers where people can have counseling, be educated on healthy foods, etc. And just the whole notion that we said, if you put excise taxes on the sugar-sweetened beverages, excise taxes on cigarettes and alcohol, all those things that we want to reduce consumption, not only do you generate extra revenue that can now be used to fund those same wellness centers and fund the whole paradigm shift to preventative medicine, but it serves as a deterrent that helps reinforce the behavior changes we're trying to achieve. So I think it's a unique opportunity and it's something that we welcome. And I think this provides us with a mechanism of being able to see changes in the area of the NCDs and the risk factors. Thank you.
Thanks so much, Dr. Gordon-Boyles. So I think you've given us a vision of preventive medicine and legislation being able to create the supporting environment. In addition to issues such as taxation and prohibition of drinking and driving and all the other specific examples, but basically an enabling environment for better health supported by legislation. Thank you so much. Now, civil society has a crucial role to play in addressing non-communicable diseases as part of a whole of society approach by participating in setting the agenda, raising public demand for policies, laws, and regulations, ensuring that services reach communities, providing people living with NCDs a voice in decision-making processes, exposing conflicts of interest, and holding governments to account. Is a huge agenda for civil society. Civil society is recognized in multiple international regional mandates as being critical to addressing NCDs. The WHO Framework Convention on Tobacco Control, for example, in its guiding principles as Article 4.7 states that the participation of civil society is essential in achieving the objective of the convention and its protocols. So, Sir Trevor, in the region, the Healthy Caribbean Coalition, an NCD alliance of over 100 health and non-health civil society organizations, continues to play a critical leadership role. So, Sir Trevor, how do you see the forum contributing to the ongoing work of civil society organizations in the Caribbean?
Thank you very much. Thank you very much, Dr. Hennis. And so, first of all, I'd like to join in congratulating PAHO and the CCJ Academy for Law and the many others involved in the launch of the Caribbean Public Health Law Forum. And perhaps the first observation, and one that I will share that reemphasizes a point that you've already made, is that civil society organizations undertake their work performing well-established roles in the multi-sectoral response to NCDs. They function as advocates, as service providers, as providers of evidence-based information for policy formulation. And they hold governments to account, undertaking shadow reporting and engaging in independent monitoring and evaluation to improve transparency and accountability. Since its formation, the Healthy Caribbean Coalition, together with its civil society member organizations, has pursued these approaches in NCD prevention and control. Support from the forum in all of these activities and approaches is vital and is expected to enhance civil society's NCD response. And an important component of that support would I suggest be capacity building within the Caribbean legal fraternity so that members of the profession become better placed to work more effectively with civil society in the NCD response. Now, there have been some specific successes in the Caribbean, such as a tax on sugar-sweetened beverages, restrictions on sale and marketing of sugar-sweetened beverages and unhealthy foods in schools, and some progress in tobacco control legislation to which civil society has contributed in no small measure. However, progress, unfortunately, as has been pointed out by other speakers, has been slow. This has led to an approach by the Healthy Caribbean Coalition, which goes beyond that emphasized in the past, an approach in which we refer to as being transformative and new. It is an approach that requires and calls for greater use and consideration of the law. Thus, most recently, the Healthy Caribbean Coalition published a report titled Transformative New Agenda for NCD Prevention and Control, which, while recognizing the need for traditional approaches to NCDs, adds transformative approaches in which human rights and equity are foundational principles aimed at enhanced human capacity and a people-centered approach. And so, to my mind, there is a potentially significant opportunity for the forum to assist the HCC in executing and delivering on the transformative new agenda in areas of human rights law, policy coherence, and trade and industrial law in our priority areas of improved nutrition, tobacco, and alcohol control. An additional specific area in which there would appear to be an important role for the forum is assisting civil society in addressing conflicts of interest issues and exploring how the new transformative agenda's emphasis on human rights and equity can assist with these efforts. For it is our sense that health policy related decisions are being taken in many instances without sufficient consideration of potential industry interference and conflicts of interest, resulting in failure to protect the right to the highest attainable level of health and the right to information. Rights that I think all of us on this call are recognized in the human rights treaties ratified by most Caribbean countries. Finally, there are at least 3 additional areas which, in my view, the forum may possibly contribute to the work of civil society. The first is the examination of opportunities for the establishment of effective platforms at the regional and national levels to allow for effective civil society engagement in health policy, a matter that, in my view, requires urgent attention. The second is a review of regional mechanisms whose work impact on health to better define the scope of authority and the nature of interaction that should take place to arrive at appropriate coherent policies. And the third and final area in which the forum can collaborate with and support civil society is in advocating for the meaningful application of the recognition given by CARICOM member states of the role of law in advancing health topics as was identified in the adoption of a strategy for health-related law in September 2015. And so as I close, a resounding yes, there is much that the forum can contribute to the civil society NCD response, and we in the Healthy Caribbean Coalition look forward to playing our part and giving the fullest support to the forum. Thank you.
Thank you so much, Sir Trevor. Thank you for that very clear presentation in which you talked about capacity building in terms of the Caribbean legal fraternity to work better with civil society and their responses. You spoke also about the transformative new agenda, highlighting human rights and equity, which I think are really fundamental to how society should function to protect human health. You mentioned also conflict of interest and the need to have safeguards in place. And then you gave us 3 very, very clear areas of work for this forum. So thank you very much for those, and I'm sure they'll be taken on board. Let me ask the moderator if there are any questions for us in the chat. In fact, while we discuss that, actually, I'm going to raise a question for the panel. I don't have a lot of time for discussion, but really, how advancing the NCD agenda has encountered a number of challenges since the 2007 Port of Spain Declaration. So from your perspective, what are the main challenges and how can the forum help to overcome them? So one quick round of questions. So perhaps I can begin this with Ignacio, Dr. Ibarra.
Sure, Dr. Hennis. I think we have lots of challenges, but we have to start from the very beginning. As you mentioned, the tobacco control may be the first low-hanging fruit that we can achieve in the Caribbean. And for that purpose, we have been supporting member states all together, all PAHO, to enact and strengthen legislation and regulations to achieve that goal. It's important to highlight that it's not just a matter of the existence of law. The law has also needs to be enforced. And that is another challenge that has to be taken seriously by the governments. I think that could be my suggestion for you.
Thank you so much, Dr. Ibarra. Honorable Justice, I have a question for you, and perhaps the issue then might be how may community law be leveraged to advance the NCD agenda, and how might the forum contribute? I'd like to have your thoughts on that.
Yes, well, thank you, Chairman. Well, as I said earlier, I think that there are various ingredients in community law which can be used to advance the public health agenda. I reference provisions in the revised Treaty of Chaguaramas. I referenced also declarations made by our heads of state, heads of government. And one of the interesting questions which has been around since we had that very interesting workshop at Mona in 2017 is whether, when combined, these treaty provisions and these policy statements can be used as legal instruments to protect public health. Now, one of the problems, if you will, challenges, is that no attempt has yet been made. As far as I'm aware, certainly before our court in relation to that matter. So the point remains still to be decided. I think, therefore, that a very important challenge, if you will, is to develop the kinds of, and I think Sir Trevor mentioned this, legal capacity within the region, which will take on the task of clarifying what the law is and how far the law can be used in areas such as this. And this, in turn, is a challenge, I believe, for those of us who are responsible for legal education, both at the faculty level and perhaps at the law school level as well. It's a challenge as well to the kinds of areas in which our lawyers tend to specialize, because very often the interest is in areas which are, for want of a better word, lucrative. And it may be thought, rightly or wrongly, that a specialization in public health law is not. I'm not in a position to comment on that. But what I can say is that there is an area of need for our lawyers to ensure that the law is used in any way it can to protect the public health interests of our citizens. And certainly, one of the objectives of the law is to test the boundaries to see just how far the law can be used in that way.
Thank you so much, Honorable Justice Anderson. Very much appreciated. I have a question from Dr. Gordon Boyle. And it really is in terms of, from your perspective, what do you think some of the priorities should be in terms of what should some of the first issues that the forum should engage in advancing? What were your recommendations to forum in terms of what should they begin their work plan on? from your perspective?
Well, thank you very much for that question. So in keeping with what I had said before, with the creation of an enabling environment that makes the healthy choice the easy choice, legislation that, one, bans the importation of industry-produced trans fats would be, for me, the lowest hanging fruit that can have the largest payoff. You might get pushback from industry, you may get pushback from suppliers and so on, but I think this is a worthy first in order of priority. Second would be, as I mentioned before, levying excise taxes on cigarettes, on alcoholic beverages, on sugar-sweetened beverages, and on unhealthy foods that are high in, the undesirables. And this, I think, again, not only would it help to deter persons buying those unhealthy foods, but it would also generate revenue that we need to be able to promote that wellness agenda and the paradigm shift in the way we practice medicine, as I mentioned before. So the banning on the trans fats would be what I think would be the first in order of priority, and then excise taxes on unhealthy foods. But even as we speak about that, if it's possible, if it is at all possible, these should be done, if possible, working in collaboration with the private sector, in that even as we make certain foods more expensive, the unhealthy foods, work with them to create other alternatives, healthy alternatives. So as the demand for alcohol, let's say, for instance, goes down, those same beverage companies will be selling water. And so we can promote the sale of water so that it can be a win-win scenario if possible. That would be my suggestion.
You are muted, Chairman. Chairman, you are muted.
Oh, I'm sorry. So therefore, yes, I'm saying that is a global commitment to ridding the food system of trans fats. So I think if the Caribbean doesn't get on board, we'll be left behind because there'll be nowhere we can export to. So Trevor, final comments from you in terms of any additional priorities or low-hanging fruits that you see being advanced through engagement with the forum.
Low-hanging fruits. I think that's a very challenging question because, quite frankly, in order to bring about meaningful change, meaningful action is required. What I would say is that at the moment, there is a significant interest, and I would dare say a significant commitment on many persons within the Caribbean region to improve the nutritional status of our people in the region. And I think that this is an opportunity not to be missed, because to address this particular issue not only is likely to improve the health status of the region, but is also likely to improve the economic status of the region. Time doesn't permit me to go into further detail, and so I will end at that point, but simply to re-emphasize that though not necessarily a low-hanging fruit, I think our emphasis should be in trying to give expression to what so many in the region have signed on to, namely an improvement in the nutritional status of the people of the region. Thank you.
So Trevor, thank you so much for those comments, and I again fully support that idea. I think 60% of disability adjusted life years lost in the region is because of nutrition. And I think the Caribbean has the highest rates of childhood obesity. A third of our children are overweight or obese. And this is a major priority because it's the biggest driver of non-communicable diseases. So you have my full support there. And on that note, I'm going to hand over to the moderator. Thanks so much to the panel for your excellent contributions. Thank you.
Thank you very much, Dr. Hennis, and to all our wonderful panelists for this initial discussion about the forum and what we are envision for the future of the forum and how it may contribute to NCDs. We are now going to move to our second panel, which is going to be chaired by Mrs. Nicole Foster, Deputy Dean, Academic and Student Affairs at the Faculty of Law here in Cave Hill campus, and she will be joined by colleagues from St. Lucia, Antigua and Barbuda, and Jamaica. And we really hope that this will be a nice complement to the discussion we just had by hearing from the countries what have been their experiences and how do they feel that the forum can help their own agendas and countries that are approaching work on tobacco control or any of the other risk factors through the use of laws and regulations. So over to you, Nicole, and to the rest of the colleagues.
Thank you, Dr. Prieto. And let me say how it's a privilege and an honor for myself and by extension Cave Hill Law faculty to have been able to participate in and contribute to the founding of the forum. And we really look forward to a close and intimate interaction between the faculty and the forum as we move forward. And Dr. Prieto said this session is intended to sort of drill down a little bit and give you a sense of what has been happening on the ground across the region for us to learn a little bit from each other in terms of what has worked, what hasn't, what they wish they had known about through a forum such as this at the time when they were engaging in the various innovations in the sense of whether it be in the area of tobacco control or nutrition policy. As Dr. Prieto says, we have with us representatives from Antigua and Barbuda, St. Lucia, and Jamaica. I'll just give you the names. We have Joanna Joseph Henry. She is Deputy Director of the Substance Abuse Advisory Council Secretariat in the Department of Wellness and Health and Wellness in St. Lucia. We have Natricia Miller, Attorney at Law and Senior Assistant Attorney General, Ministry of Health and Wellness, Jamaica. And then we have from Antigua and Barbuda, Samantha Mort, Chief Nutrition Officer and Non-Communicable Disease Coordinator, Ministry of Health, Wellness and the Environment, Joy Dublin, Crown Counsel, Ministry of Legal Affairs, and Janice Saint-Roma, Crown Counsel, Ministry of Legal Affairs. And so we're just going to jump straight into it. And the two questions that we're asking our panelists to respond to, same questions to all the panelists is, firstly, what do you think how could the forum have been helpful to you at the time when you were going through the various innovations, as I said, improvements and legal reforms, whether of law and policy at the ground level, and sort of building from there? How do you see the forum helping others who are perhaps now starting that journey or only just midway through that journey in terms of being able to better leverage law as a tool for NCD prevention and control? So I'm going to start with St. Lucia. Ms. Henry, if you could give us the perspective of Ms. Henry, is going to be drawing on St. Lucia's experiences with tobacco control. St. Lucia is a star right now. We offer our congratulations again to the Ministry of Health and Wellness of St. Lucia on being awarded the Tobacco Control Award of 2021 for your outstanding leadership in this area. And the floor is yours to explain to us a little bit about the progress you've made and how a forum such as this can be of assistance. Over.
Thank you very much, Ms. Foster, and good afternoon to everyone. It is afternoon here, or good morning, depending on the time. Thank you for the opportunity to present here. And as everyone has said, the NCD epidemic is very much very, very much present in St. Lucia. And so this was the impetus that led us to the innovations that we had to engage in St. Lucia. Like other countries in the Caribbean, St. Lucia is party to the World Health Organization Framework Convention on Tobacco Control with its 30-something articles and very little resources, all of the resources to be able to implement. And so things had lagged in St. Lucia for quite a while after the first signing of the treaty. But then what we also noticed happening, and it was a very, very, very important mandate, was that like everywhere else in the Caribbean, we started to see this rise in the number of deaths and the number of NCD-related deaths, the number of NCD-related illnesses, and we lost colleagues, we lost family members. And so there was this concern that, okay, we have a very serious challenge here. While we want to get ahead with a big comprehensive policy, tobacco control policy, and the legislation, but you know, in the Caribbean, we have a phrase called shortcuts. So we decided we're going to prioritize certain areas and see how we can fast track this. And in this case, St. Lucia did take the route of reaching for low-hanging fruits by making amendments into existing legislation. But we had a plan. We have an NCD policy, which is a cabinet-approved NCD policy, which, as other speakers from the panel before indicated, really focuses on preventative health. And so we were able to assess where do we need to place focus and what sort of policy actions do we need and where do we need laws and amendments in our existing laws so that we can get ahead and begin to take some priority steps to address the NCD issue that we were having. And we all know that tobacco is a common risk factor for all of the NCDs that are affecting us right now. And so we stuck with our NCD policy. We were also informed by the Empower tobacco control measures. And so we set forth. We worked with the St. Lucia Bureau of Standards. I'll give you some examples here. We worked with the St. Lucia Bureau of Standards to bring in one of the first legislative changes or amendments, which is the 50% tobacco package labeling. So this came on in 2017. After that, we worked with the Public Health Act and made amendments so that we could address smoking control in workplaces, in public places, sports, health, all of those agencies and those health and those places where people have to congregate. Because our Global Youth Tobacco Survey indicated that while, yes, adolescent use of tobacco is reducing, but there was still a very, very high level of exposure in public places. I think about 43% of our young people indicated they are being affected and being exposed to tobacco smoke. So that said a lot, and that's a very, very high figure, even while we have the use of tobacco by our young people decreasing. It says something else is happening in the population. So in 2019 and 2020, we saw the amendment of public health and the regulations to follow to actually begin smoke-free spaces in St. Lucia. Moving to another example, we are now working with the St. Lucia Bureau of Standards, where we will be working with their legislation to bring on the frontal package warning labels. Everybody knows that this is an initiative happening for food labels. And so this is another aspect of NCD control that we will be addressing within existing legislation. Now, it does not mean that we have put aside our efforts in terms of comprehensive tobacco control, tobacco legislation. This action is continuing, but what we have found works for us and is easier and more effective for us and providing us with those immediate responses that we need in light of our public health urgent situation with NCDs is that while we are working on those bigger mandates, and those are really, really big mandates, these take years to implement, we have been able to get ahead and to have gains in terms of our NCD agenda by taking the little shortcuts. You know, our mothers used to warn us about the little shortcuts. Well, in St. Lucia, our little shortcuts have helped us to get further ahead along the journey. So at present, we do have a Bloomberg Philanthropies grant, which is active, which is ongoing, which to help us to develop our tobacco control, our national comprehensive tobacco control policy. And we expect that when that is completed, we will be able to move ahead now to look at our national tobacco control comprehensive legislation. And so anybody who is looking, this is a good example for other countries who may be struggling with the big comprehensive package. Thank you for the time.
Thank you very much. And I think that's a very useful experience, especially for small island developing states such as ours, which, as you say, often have the challenge of limited resources. So let me just move straight along to Natricia Miller for her to share a little bit about the Jamaica experience in terms of the use of law and policy to advance their public health goals as it relates to NCD prevention and control. Natricia, the floor is yours.
Thank you. Thank you very much, and good day to all. Now, Jamaica seeks to utilize a menu of policies, regulation, and strategies to tackle NCDs and to drive and change behavior over time, including the establishment of NCD-specific task force and committees, law reform initiatives, and policies. Some of these initiatives are the Jamaica Moves National Campaign, which is a campaign to encourage Jamaicans to become more active of all ages. Also, we have embarked on the initiative of banning sugary drinks, especially in public health facilities and in schools. Health systems improvement, where we are recipients of loan and grants to deal with the improvement of our health systems and to ensure that to support health system strengthening programs for the prevention and care and management of NCDs. We also have set up task force and committees to deal with the issue of NCDs. Currently, we have the National Food Task Force. This task force was established to respond specifically to the NCD problem faced by Jamaica. The task force is engaged is engaging the Jamaican food industry in addressing several issues dealing with unhealthy eating habits of Jamaicans. And some of these ways in which the task force is engaging the industry is discussion on food labeling. The food industry will be encouraged to ensure that all prepackaged foods have understandable nutrition labels. We are working with the industry in terms of nutrition and health education promotion. So a wide range of nutrition education program designed to highlight the dangers of unhealthy eating is being developed by the Ministry of Health in collaboration with its partners. Also, in terms of tackling inappropriate food marketing, healthy government institutions, which should see physical activity program for government staff, and as an initiative to reduce stress and recipe analysis, weight management, etc., etc. So the task force is also responsible for engaging and treating with the issue of young child nutrition. So programs are to be developed and have been developed to strengthen protection and promotion and support for the optimal breastfeeding to explicitly address obesity and complementary feeding practices. So there are several initiatives. The task force has a responsibility to treat with NCD problems and to engage in terms of nutrition. We also see where the government of Jamaica has established a national committee on NCDs. This is a 25-member team, which will be charged with boosting or encouraging and ensuring the ministry's work to effectively combat NCDs in Jamaica. They will provide leadership for multi-sectorial action with a goal towards advocating and recommending policies and programs for the prevention and control of NCDs. A key aspect of the work of the committee is to review and make proposals to the ministry on the various policies, laws, and programs in keeping with our national and regional and international commitments related to NCDs. Also, in terms of legal reform, we haven't assessed and examined our legal framework in Jamaica. We have identified, we haven't paid much attention to identifying where we are and assess where we need to go. But forums like these or fora like these have encouraged us to look a little bit more closely on our legal framework. And what we see is that we do have a legislative framework that speaks specifically to NCD and NCD risk, especially in terms of prevention and control. And just to name a few, which most countries do have, the Pharmacy Act, the Dangerous Drug Act, the Precursor Chemicals Act. And that's some of the areas in which the legislative framework covers the area of prevention and treatment of NCDs. Specifically for treatment, when we look at our Drug Court Act, the Mental Health Act, and the National Health Fund Act, you see where we do have a legal framework. Jamaica, as we are aware, is moving towards a comprehensive overhaul of the tobacco control regulations. The Tobacco Control Bill is now being discussed by a Joint Select Committee of Parliament, which seeks to address, this bill seeks to address critical matters that have not been addressed under the existing tobacco control regulations. And these include regulating the interaction of government officials, which is a crucial article obligation 5.3 under the FCTC. And so it is interesting, and it will be interesting to see what is the outcome of the Joint Select Committee discussion on this bill. And one of the most important area, and I think perhaps one of the most controversial area of the bill in treating with government officials and their relation to the tobacco industry, and even regulating price and tax measures. So some of the articles which we did not treat with under our regulations, our comprehensive bill is seeking now to ensure that we're fully compliant with these obligations. The road towards law reform in the area of NCD. So whilst we have identified that we have a broad legal framework, we also recognize that we have not been paying much attention to this framework. We have, as most countries, been concentrating on communicable diseases and have not shown much appreciation for the framework that exists already in terms of NCD. And so in terms of law reform, having a forum like the Public Health Law Forum will encourage participation, will encourage better appreciation for what already exists, and will encourage consideration for legal reform, whether comprehensive, whether it is to deal with existing legislation, example, or food and drugs legislation that speaks to nutrition. But when you look at the skeleton provisions of it, you see where this process and this forum will inform a more comprehensive approach and amendment to our Food and Drugs Act to deal with the area of nutrition. And so our road to legal reform has taken basically the same shape as other countries. We have policies in place, such as the interim policy on sugary beverages, We have a draft national school nutrition policy under consideration. We have our national infant and young child feeding policy, draft policy on alcohol, which is now before our cabinet. And we at the Legal Services Unit of the Ministry of Health and Wellness have done several legal assessments in these areas, in particular in the area of food and drugs. And so we have been busily trying to work and trying to gather our thoughts as to how we can effectively contribute to when NCDs become at the forefront of policy. So we have been doing our desk reviews and our assessments on these areas. Also, the road to
so Tricia, I'm sorry, I'm gonna have to interrupt you here because we're a little bit over time. So let me just go on to Antigua and Barbuda and give them an opportunity to come back in, and maybe we can pick up some of this discussion in the question and answer session. So at this point, I would invite Antigua and Barbuda, Samantha Mowat, Chief Nutrition Officer and their lead on NCDs, to make her presentation, share her ideas and have the conversation about the Antiguan experience as it relates to tobacco control. It'd be very interesting to see if you had a similar approach to St. Lucia, which is to have a graduated approach to the tobacco control reform. Over to you, Samantha.
Thank you, Nicole. Good afternoon, colleagues. Great to be on this meeting to share Antigua's experience. Just to give you a little background, Antigua and Barbuda started work on our Tobacco Control Act in 2008. So we started big, even though it was a long process. We started on our act, working on it in 2008. However, at that time, because there was not a lot of similar legislation in the region, we sought guidance from other member states who had tabled other types of tobacco regulations or policies. Using their country experiences and guidance from PAHO, we're able to craft a powerful piece of legislation that eventually would protect Antiguans and Barbudans from the dangers of tobacco use. So just getting into how I think that the forum could have been helpful to Antigua at that time. So our act, our Tobacco Control Act, was passed in 2018. So when drafting our tobacco legislation, the forum could have served as another resource to help our drafters, since there were not many countries at the time that were working on it. It took us over 10 years to get from having a draft legislation to getting our Tobacco Act of 2018. And I think going forward for other countries, having the forum could have helped in saving, your drafters and your planning committee's time in putting together these legislations or policies or regulations, whichever way you'd want to go. I think also with the development of this law forum, it gives Caribbean countries a resource that they can relate to, since our legal framework is similar. And the other advantage is that we are all battling the same problems with NCDs, working on the same policies, whether it's tobacco, sugar-sweetened beverages, trans fat. So no one country now has to start from A, you don't have to recreate the wheel or start from scratch. So hopefully coming out of this, countries would not take as much time to transition existing draft regulations and legislation to actual policies and legislation. Antigua and Barbuda continues to allocate resources to strengthen tobacco control, especially as it confronts the heavy burden which non-communicable diseases have placed on our health sector. Draft regulations currently are in process, and hopefully we're hoping to have those completed by this year. We are immensely proud of the strides that we've made towards strengthening the tobacco control, and we look forward to a tobacco-free Caribbean. I think now more than ever, we encourage other CARICOM countries or countries in the region to continue to work together, and especially now that this forum exists, to help us the region to strengthen our tobacco control. And Antigua and Barbuda is willing to help in any way possible from our previous experience. Thank you.
Excellent, Samantha. Really useful comments there about the role that the forum can play and how you could have benefited if only we had managed to have it at the time when you all were going through this process. So at this point, ladies and gentlemen, I'll just ask the moderator whether we have any questions. I know we're a little bit tight on time, but if at least we can allow for 5 minutes or so of questions, if there are any questions there.
Thank you, Nicole. So I don't see at the moment any questions in the chat.
Okay, so I had just one or two quick follow-up questions then. So Natricia, I was wondering, so you talked quite comprehensively about the range of measures that you have in place, combination of laws, policies, etc. Dr. Barra, the Ignacio, would have made the point that really in terms of law, one of the key challenges that we have is enforcement. And I just wondered if you could share a little bit, what has been your experience in terms of your ability to enforce these measures and monitor and ensure that there's effective implementation? Has that been challenging, or have you been able to manage that process satisfactorily?
It remains a challenge. It is a challenge. Whilst you try to make the requisite legislative provisions for enforcement, what we find, especially in our tobacco journey, is that training is a requirement, and it's a continuous requirement. You have so many sectors that play a part in the enforcement of the tobacco regulation, and they require training. And that has been a challenge. We do note that the personnel who are in charge of enforcing are eager to learn. They need to understand. And therefore, I believe in terms of this forum and the area of training is very, very important, because in terms of tobacco control, we found, or we're finding, that persons would like to know how to carry out their duties. So we have made provisions under the law. Persons need to appreciate the area of law that they're asked to enforce, and they would like to know or have the requisite legal analysis and instruction as to how to go about enforcing it. So it remains a challenge, enforcement, but I find that if we rely heavily on training the different entities and players that are asked to enforce these provisions, then enforcement, we can move towards better enforcement under our legislation.
Okay, thank you very much. I think that was an important perspective to bring to play, because enforcement is across the board a challenge, I think, for all countries. And so it's really useful to have a sense of some ways that we can tackle that. And I'm sure that Elisa and the others are noting down this as a potential area of work in terms of support to member states by the forum. So with that, ladies and gentlemen, unfortunately, we're out of time for this panel. We're a little bit over time. And so I have to hand back over to the moderator. So I hand back over. So thank you very much to our panelists. I'm sure that you found the exchange useful and valuable, and really this is the intention of this forum. We're going to continue to build on these relationships, on these exchange of experiences across our region to come up with the best responses to our NCDs epidemic. And so with these words, I hand back over to Dr. Prieto, the overall moderator. Thank you.
Thanks so much, Nicole, and thank you, colleagues, for sharing your experiences. I think we got a lot of food for thought, like Nicole was just mentioning, with areas that you have pointed out as areas of priority. And I think this is the overall spirit of the forum, really crafting it in a way that it's helpful to member states and really meets your needs. So thanks for that. We're doing very well, very good with time, and we're only a few minutes behind. So I will now hand over to Justice Anderson for final thoughts, final notes, and closing remarks. Over to you.
Thank you very much, Dr. Prieto. Distinguished participants, colleagues, ladies and gentlemen, it is honestly with a feeling bordering on nostalgia that I undertake the task of giving closing remarks at this, the launch of the Caribbean Public Health Law Forum, June 30th, 2021. Over the course of the last hour and a half, you have been informed or reminded about the background objectives and expected outcomes of the forum under the able leadership of Dr. Anselm Hennis, Director, Non-Communicable Diseases and Mental Health Department at PAHO WHO. And you'll know, of course, that the core of the forum's raison d'etre is encouragement for using the law as a tool to tackle the scourge of NCDs. You have also been exposed to successful approaches to the use of the law to address NCD risk factors from the perspectives of Antigua and Barbuda, Jamaica, and St. Lucia, notably in relation to tobacco control and efforts at addressing diet-related NCDs. This under the guidance of the brilliant and engaging Mrs. Nicole Foster, Deputy Dean of the Faculty of Law, UWI. What now remains is to ensure that we build on this launch. For this to happen, several technical and facilitative measures will require our attention. First and foremost, additional nominations from Caribbean governments are welcomed on an ongoing basis for officials working on NCDs and related matters, along with relevant civil society organizations and partners in academia, given the membership profile we agreed at the sub-regional meeting in Miami in March last year. The steering committee in the coming weeks will be redefining this nomination process to possibly include other categories of persons, including possibly students. Declarations of interest will be required from all forum members. Second, we need to secure internal arrangements for the organization, stability, and future operation of the forum. For this purpose, the steering committee proposes a business meeting of all confirmed forum members, at which the terms of reference of the forum will be formally adopted. The leadership of the forum will be elected, and other important legacy decisions will be made. More details about this business meeting will be shared in the coming weeks with confirmed forum members. Third and finally, on behalf of the steering committee, I encourage you all to remain involved with the forum, whether you decide to become a member or not. In this regard, may I issue a special invitation to members of the media to consider conveying any messages and recommendations made by the forum for the wider public audience. Communication of forum suggestions and commendations will be a key strategic deliverable in ensuring good public health outcomes. So once again, thank you for your attention and participation. We look forward to a healthy and productive relationship over the next few months and years. Thank you and good day.
Thank you, Justice Anderson. Thank you again, colleagues, for joining us today. As mentioned in the chat, we will be sharing the recording of this session and more information to come. Thanks again for joining and have a good day.